Hello, this is Dr. Gay from First Look MRI, and this is a 61-year-old female with history of chronic low back pain, worse on the left. And on this view, down in the lower lumbar spine, this is the L5-S1 level. You can see a yellow line corresponding to where we are. This is L5, this is the sacrum, and this is the yellow line indicating where this image is. Now to get oriented, this is the belly button here on the left-hand side. This is forward, this is top, bottom, this is the back of the patient here, and each square here is a vertebral body, a piece of bone. This is L5, L4, L3, L2, L1, and each little dark band is a little cushion, an intervertebral disc that acts as a shock absorber. Now in this view, we have an axial view, and we see the abnormality right here. We see a little round, looks like a little ball, and it is on the left-hand side. This is the right, this is the left, and it protrudes into the spinal canal. The spinal canal is the fluid-filled sac where the nerves go through. You can see these little dark specks. These are nerves going through that spinal canal. And we see this little round ball here pushing the spinal canal to the right, displacing some of these nerves here in the spinal canal. Now this is called a facet joint here on the left. Here's a facet joint on the right, and on this axial view, I see that the facet is not normal on the left. There's a little bit of fluid in the facet. It's a little irregular, so they have arthritis on the left. On the right side, they also have arthritis. It looks like it's even worse. A little bit of irregularity and fluid, a facet joint effusion. So this may be contributing to their back pain, bilateral facet arthritis and facet joint effusions. But this looks like it comes off the left facet joint, and this looks to be a really prominent synovial cyst. These commonly come off the facets. When they do, they usually go forward. Sometimes they can go off in the back, and they're asymptomatic back here, but when they go forward, they protrude into the spinal canal or into the foramen. This is the foramen over here, and they can cause pinching of nerve roots and pain, as in this patient. And so this is fluid in a synovial cyst that comes out of the left facet joint here, and this is what is causing their symptoms. If we look on this sagittal view here, if we roll to the right side, we see maybe another little tiny synovial cyst here, and on the left side we see this large one right here. So a left facet joint synovial cyst contributing to their low back pain, and thank you very much.